Welcome back, everyone. It's Robert Ridpath from Health Synergy, and today is really a special day for us because we have the opportunity to speak to someone who has not only frontline experience, but they also have a healthy aging, preventative aging clinic. So we're going to get two different perspectives on this COVID-19 thing from the front lines, what we can do, and maybe some tips and insights we can get in terms of keeping our bodies strong and building up our immune system. So I'd like to introduce Dr. Anna-Marie Wysynski. And hello, Anna-Marie. How are you?
Hi, Robert. I'm well. How are you?
I'm great. Thank you.
Awesome.
So, thank you for taking some time to talk to us today. I really do appreciate it, and especially as a frontlines worker, I know how busy you are. So thank you very much, and I think our listeners are really going to appreciate this, so your time will be well spent. I think it will serve a lot of people. So
it's wonderful to spend time. I appreciate the invitation.
Yeah. So some of the questions I have for you, it's very interesting, but the first thing I should actually, before I get to my questions, is please share with us a little bit about you, about your frontline experience, and then your healthy aging preventive medicine clinic. Can you share that with our listeners, please?
Absolutely. So I have been trained in Ontario as a family physician, but my practice has been limited almost exclusively to emergency medicine. And now I'm approaching my 18th year in the Emerge. This is my at least 7th pandemic that we've gone through, endemic pandemic. And so I am on the front lines in a smaller community hospital where literally there's myself and 2 other nurses in the emergency room to deal with emergencies and patients' health. We don't have backup. We don't have specialists. We refer out to other centers. So we have to know our stuff, and we're on the front line literally. And as I had graduated, I learned about functional medicine, and I trained in the United States. I was the first physician in Ontario to be board certified in anti-aging functional and regenerative medicine. And with that, I became the medical director of what we now have rebranded ourselves at as Dr. Wysynski Bespoke Functional Medicine, where we do customized, personalized care for each individual with respect to hormone replacement therapy, which is mostly what brings people in the door. But we deal with a variety of concerns and illnesses from a prevention and potential reversal perspective, using natural means, lifestyle, and nutrition primarily. We do use some pharmaceutical drugs, but that's always our last resort. We try and correct the problem rather than treat the symptoms. So it's very different than regular allopathic medicine.
Wow. So truly, you have both ends of the spectrum: acute care, emergency medicine, and at the other end, this concept of functional medicine addressing the underlying cause versus just treating the symptoms. And at the same time, helping us age healthy and keep at it and keep on, if you will. So that's pretty amazing. Thank you for sharing that. So some of our questions for you are straightforward, but I think people still really need to hear this. And right now, getting into your, say, emergency room idea, when people come in, what are their, how do I say it? Are they young people? Are they old people? Are they 30-somethings? What kind of people are you seeing? And did they have a pre-existing condition? Were they immune compromised, or were they pretty average people that picked this up and now this has gotten to them at a deeper level? What's your take?
Rob, in our own environment in the Emerge that I work in, remember that's just a small microcosm and not necessarily representative of the greater whole. We've had elderly patients. So this past week, when I went back after about a 13-day hiatus, my very first day was treating few patients, but those who were there are very, very sick. So the usual stuff that we're seeing in Emerge has fallen by the wayside, thank goodness, because we wouldn't be able to handle this viral pandemic and its urgency with the same kind of volume that we used to have of people coming in with lesser than emergent concerns and emergency. And our hospital is such that there is no walk-in clinic or urgent care available, so we serve a multitude of needs. But my first day back, I intubated an 80-year-old person. I'm trying to be very diplomatic here, not reveal genders so as not to reveal identity, as is my legal and ethical responsibility. Another patient have come in with concerns. People want to know, even prior to this stay-at-home order, do I have it? Could it be COVID? We're not widely testing. We're not widely protecting in terms of masking the public or masking hospital staff at this point. I did a webinar for my client, Tel, and the public a few days ago, about 10 days ago. And interestingly, my research reveals that the median age in Wuhan was 47 years old. And those with the severest of disease were only 7 years older than that. So this is touted in the media as being a disease that is striking down elderly folks. Typically, elderly have more compromised health. They have less biologic reserve and perhaps more comorbidities. But really, our positive case of COVID that is admitted to our hospital is a young person, healthy individual, business person who has traveled. And so we're seeing institutional spread between healthcare providers and from healthcare providers who are infected and asymptomatic or mildly symptomatic. But now we're seeing it in our age group, in the, sort of the 30 to 60-year-old age group is very, very prevalent. In fact, in younger age groups, let's say 20 to 40, healthy people are coming in with mostly GI distress. So we laughed at all those people buying toilet paper. And although this is not a diarrheal disease per se, the GI symptom presentation in the younger population is very, very evident.
Wow. Very insightful that from the front lines, what you're seeing in your small microcosm, as you said it. Mm-hmm. Now, let's jump to something, but it's very related. You talked, and in your other practice, if you will, it's about preventive health, it's healthy hormones, healthy aging. And yes. One of the things we know about healthy aging is having a good, strong immune system. And as they have read, so much of your immune system is located in your microbiota. Everyone's talking about the friendly bacteria down there. And you just brought up that idea that for some people, they're getting these GI symptomology. So if GI gut health is so important, can you elaborate a bit on that and tell us maybe some things you would recommend to help build up the GI health?
Absolutely. So even though that 20 to 40-year-old age group is presenting with GI symptoms, it's not necessarily because their GI system is weak. So we know the COVID virus affects the spleen, the gastrointestinal tract, so the large and small bowel, as well as the lungs primarily. So those are the three organs of target of the virus. But in terms of general overall health, you're right. In my clinic, our goal is to integrate, rejuvenate, and elevate. And so we try and elevate people to optimum health, whatever that is for them, whatever biological potential that they have. And you're right, the gut is exquisitely important in immune function. We think that the lymphatic system and the white blood cells, the immune cells are the be all and end all, but what really our first line of defense is the GI system. And when our GI tract is healthy, it helps us not only digest and assimilate foods, it actually serves as an incredibly potential immune barrier, starting with the mouth with the saliva and the enzymes in the mouth, right down the esophagus into the stomach with its high stomach acid, and then in the intestinal tract with all the microbiota, or all those friendly bugs, as we like to call them for people who don't understand the microbiology. Digestion and absorption is really important. The mucosal layer throughout the entire GI tract is extremely important. Having non-breachable barriers, so not having ulcers, or having what we call leaky gut syndrome, and then the digestive function and elimination. So having proper stooling patterns, making sure that we're not having decreased transit time with constipation and bloating and gas. Those are all indicators of a non-optimally functioning GI system and can put us at risk of infection. So interestingly, years ago when I was studying functional medicine, there was a concept that blew me away. And that was from our lips to our rectum, or our anus, it is external to the body. And it took me a long time. It was sort of like I was kind of stunned at that concept. But if we consider that concept as fact, just for argument's sake, and we think about that as an external to the body, it really is part of our barrier to infection, just like the skin is, or the mucus in our nose, for example.
Wow. I'm just trying to piece all these things together here because you talked about the gut, you talked about these friendly bacteria and how it's actually outside of us. And this is just a new way of thinking, but it's outside of us, yet through that tube, the membrane is very permeable and selective and components can come in, and all the immune cells down there, all those bacteria, I've read that there's more immune cells in the gut than there are in the whole body, and they produce all kinds of compounds that can get into these signaling molecules, get into our vasculature, and all the components of the immune system talk to each other. So that's really very interesting. And in terms of things like those friendly bacteria, probiotics versus prebiotics, the foods we can eat, do you have any basic recommendations that you would recommend to, say, someone like me, if I came in, I don't want to get sick, or one of the premises that we've been talking about in our interviews is I've read anywhere from 60 to 85% of us are going to get this virus. And so based on those numbers, we don't want to get it now. We want to flatten the curve, spread it out. So if we're going to get it, what can I do to build my, say, gut health up so my duration is much smaller and my severity is lessened, so I don't end up going to the hospital, and if there might not be respirators and all that sort of thing. So, and heck, I hate being sick. I think most people do. So what can we do for gut health to boost up our immune system? And I understand that in medical practice, you can't give people's names away. You can't make recommendations for specific symptoms. Obviously, we're in a public forum when we do this, but general recommendations. So
absolutely. And thanks for that caveat, Rob. That was exactly what I was going to say first. So I am legally bound to not prescribe or give medical advice in this forum. So yes, it all will be in generalities. So gut health is really important, and it starts first in our mind. So I can tell you that I have had I can't say that word today, a lot of stress around this COVID situation for a variety of reasons. But our thoughts can release stress hormones, and our stress hormones actually can damage the integrity of our gut. We call this a leaky gut syndrome. So making sure that we de-stress the best that we can, keeping on happy thoughts, listening to things like music that can actually stimulate happy hormones in our body, eating foods that produce great feelings in our body. And for most of us, a lot of that is sugar, caffeine, bad fats, sweets. We want to stay away from those first and foremost. So our mind can help not only with our thoughts, but with our choices. Number 2, eating the foods that we can in terms of providing, as you say, prebiotics, which are the foods that support the development and maintenance of the quantity and quality of the gut bacteria. So one of the things that I have done personally is I have enjoyed some fresh artichokes. Introduced to those years ago, I boiled those up, and every day or so I eat artichokes because just by my digestive function, I know that they support prebiotics. They are a prebiotic to support the microbiotic environment in my gut. I also have a supplement that is a homeopathic that I'm using to support prebiotic function. There are many foods like whole boiled potatoes that can help with prebiotics as well. In terms of probiotics, we could get those from our foods as well. So a variety of foods from the rainbow. You know, one of our experts, Deanna Minich, always says, eat the rainbow. So eat the rainbow. Have lots of colorful fruits and vegetables on your plate, and really focus on a variety of products at each meal that really make your food quite colorful. That will also give us antioxidants. It will give us quercetin, which is a bioflavonoid, which supports immune function. And then if people wish, they can use a commercial probiotic preparation in the form of a capsule or supplement. My recommendation is always, and I'm biased about this, but my recommendation is always pharmaceutical or physician grade probiotics with a reputation. And why is that? Because the adherence to the bowel wall has been proven in these superior formulations, rather than passing through the gut and into the stool, where basically we're taking them in and excreting them out. Making sure that it's a balanced formula. If there's children, there's certain bacteria that need to be supported in children, especially under the age of 2 or infants. Whereas people over the age of 2 and specifically over the age of 10 need a broader spectrum probiotic, not just one that has a form of bacteria in it like lactobacillus. That may be okay for certain conditions, but not for general overall prevention and health. Making sure that the probiotic doesn't give you bloating or gas or diarrhea is really, really important, because that may not be supporting your gut health well. So if we have what I call soft toothpaste consistency, slithery, snaky stools on a regular basis, ideally after each meal, then you know that your gut is functioning well, as opposed to having more liquidy or solid bowel movements.
Okay. Yes, always when we have these discussions about gut function, you get into bathroom details, and a lot of people are uncomfortable with that, but it is a fact of life, and it does tell us a lot about how well the digestive system and how well that gut's working. So excellent insights. I keep writing all this stuff down. My page is almost full.
In functional and allopathic medicine, from children up, once children start to wipe their own bottom, I always recommend that people stand and take a look in the bowl before they flush. Why is that? Because our stools do tell us so much. Even in our older years, when stools start turning black or red, you want to know that blood or dark coloration is there. Or if you're having undigested food particles in your stool, that tells us a lot of information about how the gut is functioning. So yes, you know what? Make it a point. Nobody likes to talk about their potty secrets, but keep your secrets to yourself unless they need to be revealed if something is abnormal.
There you go. Fantastic. Some of the other questions, because I feel always the time pressure, because I know we don't have a lot of your time. What about things that we can do to build ourselves up? So if we want to build up our immune system, so as I said, reduce the severity, reduce the duration. We talked about improving gut health. Are there any other things we can do from your perspective as a physician who also works in healthy aging? And what can we do to build up our immune system would be my question to you.
Wonderful. So first of all, we need to sleep. We need adequate, deep, restorative sleep. So sleeping, even if you're sleeping more than usual right now, is not a bad thing. We need to decompress. We need to heal. There's tons of things that go on in the night, including healing of tissues, immune surveillance, and expression and secretion of hormones that help us deal with stress and repairing our bodies and our minds, laying down new memories and other things. Number 2, move. I know we're not allowed to really move outdoors in great numbers, but you could go into your backyard. You could walk up and down your stairs if you live in an apartment complex or a home with stairs. You can get your skipping rope out. It's spring. Skipping ropes and puddles go really well together, and that alone can actually increase immune function through lymphatic drainage. Simple walking, rebounders or trampolines at this point can work. There's lots of things. Playing music. Do you know that when we sing, we actually release a hormone from our pituitary called oxytocin? And that's the love hormone. That's what makes us feel like we're in love and connected. It's actually the hormone that physiologically allows women to let down milk in breastfeeding. But especially right now with our social distancing and our isolation distancing, many people are feeling very isolated and alone, lonely. So when we sing, we can actually release oxytocin and feel more connected with the ones that we love and feel that feeling of love. Self-love is really important, and self-care. And I tell people to do this guiltlessly. This is part of what I teach in my functional medicine practice. But right now, self-care is really important. Just as in an airplane, put your own mask on first before you put somebody else's, or the other saying you can't serve from an empty vessel. Really important right now. I know it sounds selfish, but if we are caring for ourselves and being the best robust specimen we can help each other, especially when times come when we all have our breakdowns and we need that emotional support, or we need to emotionally support somebody else. Eating good quality food and a variety of foods. So protein, avoiding our snacks and junk foods. Yes, my husband and I have done some fun meals, but we've already been really conscious of limiting those. Do you know, Rob, that if you have even a teaspoon of sugar, it can reduce your immune system by 30%?
Wow. So what happens when we have a soft drink once an hour, or we have, and I hate to say this, and burst the bubble of wine or alcohol, it's kind of like liquid candy as well.
It is.
And then many people I notice on Facebook are cooking and baking like crazy, and I see a lot of cakes and snacks and things. That chronic intake of sugar could be chronically suppressing our immune system.
Absolutely. So even a candy treat, for example, when we were at Emerge last week, somebody had been somewhere where there was a raffle and they won a party bag of varieties of candies, some that we would remember from years ago, sweet tarts and, rock rings and stuff like that. And the donator of the bag, the gift bag, when they found out that they were going to bring this to Emerge, donated a second one. And it was very, very tempting to have that little sweet treat, especially to reduce the stress. But I was very cognizant also that in this setting, when I'm immersed in, sort of a environment of high potential for infectivity, that sugar is not exactly the most important or the best choice to make. So I've been carrying my meals and making sure that they're well balanced. Having caffeine can also help in terms of caffeine can be very stimulating. and very helpful for the immune system. However, it has too many negative effects like sleep disturbance and producing diarrhea. However, healthier coffees can be very beneficial, especially Swiss water decaffeinated, those infused with something called Ganoderma from the reishi mushroom. Ganoderma actually stimulates immune function and is pH neutral coffee, so those can actually be better alternatives. Drinking lots of water is really important to everything that we do. People know if you've used a battery before, if the energy in the battery is low, it doesn't function well, or you watch a grape become a raisin. When our cells are raisins, they don't excrete the byproducts of metabolism and toxins build up. They can't function well for us. So by plumping everything up and keeping them really beautiful, if you don't like water, flavoring it with lemon or lime is perfect because it can help restore that pH and the acid in the gut. Also, herbal teas can be very beneficial. We saw from Wuhan, drinking hot beverages can actually destroy the virus if it's in our oral pharynx or in the mouth and the back of the nose and throat, and actually destroy it as it goes down into the stomach. Being careful, however, not to drink scalding beverages on a regular basis because it can negatively affect the lower esophagus with precancerous changes in the esophagus. So good things can lead to not such good things if overused, but generally speaking, if people are wise and they don't scald themselves with hot tea, it will be very beneficial for them.
Wow. And as Canadians, we're now into April, and most of us have not had sun on our skin for 6 months or more.
At
and
least.
The days are getting sunnier. People are wanting to go outside. It's almost like I need that sun. But without the sun, we aren't making and activating vitamin D. So
Right.
any thoughts, or what is your take on vitamin D, and particularly, say, vitamin D supplementation? Should we need it, or what do you think?
Absolutely. So vitamin D is crucial to our immune system. Vitamin D is inefficiently created in our skin. Even if we were to be at the equator and expose ourselves to the sun, our bodies are quite inefficient. But getting sun can be very beneficial for our mood, for our mind, for our body. So I say yay to vitamin D exposure on your skin. So unprotected, meaning no sunscreen, before 11 a.m. or after 3 p.m. can be very beneficial as long as we don't turn reddened and we don't burn. In fact, studies have shown that in people who are born blind, they have less vitamin D in their bodies, and they cannot protect themselves from the cancerous effects of lack of vitamin D. So it's not only the skin, it's also seeing that sun and having the pineal gland, which is the gland that receives the light dark signals in our brain, making sure that that's stimulated. And do we need supplementation? Again, I say yay. It is really vital that we keep our vitamin D up. And Health Canada only recommends 2,000 international units per day, either in drops or tablets. However, I can tell you specifically that after measuring my vitamin D, it takes me about 12,000 international units a day to keep it just at the very lower limit of the target range. So yes, vitamin D is essential, and it's one of the nutrients I highly recommend during this time.
Okay. Well, our time's pretty well run out, but I want to give you the opportunity. Are there any key takeaways you'd want to share with people regarding building themselves up over and above the amazing stuff you've already shared?
Yes, absolutely, Rob. So number one, stay at home. Full stop. Stay at home. The isolation is essential, crucial. Wash your hands. We don't wash our hands well enough. So singing the happy birthday song, washing around the cuticles and underneath the edges of the nails and in the web spaces reduces disease. And if there's no nail brush, just simply using our palms to scrub underneath the nail surfaces and going around each nail, around the cuticle, is really important, and moisturizing afterwards because bacteria likes to hide and viruses underneath the scaly skin. Vitamin C is very important, as are vitamin E, vitamin D, as we discussed. The minerals selenium and zinc, very, very beneficial. Mushrooms, medicinal mushrooms, not the kind that make you high, but the type that give you immune function like reishi or lion's mane, can be a nice supplementation. Various nutrients can be very helpful. Stress reduction is really important. I can tell you that in my own experience, I've had a heightened state of awareness, anxiety, and stress over this, but trying to bring ourselves down and focus, mindfulness practices, being in connection with people, even though we're disconnected through distancing, great sleep, as I said, gentle movement, and a belief in our well-being. Our beliefs often dictate our outcomes. So the whole package is there.
Okay, wow. I took half a page of notes, all these scribbles around my questions. So thank you. And we really do appreciate your time and your insights. That's what people are looking for right now. They want something, instead of just sitting there waiting for the virus to hit them. Well, let's do some prep work. Let's build ourselves up. Let's increase our mood. Let's build our immune system up and get ready. So when we do get sick, as I've said a few times, reduce the duration, reduce the severity, and get over this and get on with life. And the sooner this all happens, all of us will be doing better, and we'll get back to, I don't know what the new normal is going to be, but that will be a discussion for another day. So
Absolutely.
Dr. Anna Maria Wysynski, thank you very much for your time, your insights. I do appreciate it, and I look forward to speaking to you again soon. So thank you very much.
It's been an honor. Thanks, Robert.